Hi, my name is Dr. Johnson, and today we're talking about attention deficit hyperactivity disorder or ADHD. ADHD is a neurodevelopmental disorder that is typically characterized with inattention. One aspect that most people are familiar with that also comes along with that, which we would talk about, is the hyperactivity. So these characteristics, whether it's impulsivity, hyperactivity, or inattention, are the common characteristics across multiple settings for ADHDs. So from a clinical sense, you won't see it just at home or just at school, you would see it across settings. So this is very important when you consider assessment for ADHD. Another aspect that kind of stands out is this is lifelong. People may cope better as they age with ADHD. I mean, if you think about it from a logical sense, a structured classroom setting, young age, of course, you're gonna see some of these behaviors, especially in boys. But as a person age, think about whether it's more hands-on or in a job front. I'm not saying there won't be any problems related to ADHD, but at the same time, that they're probably more likely to cope. Where some of these items that stand out and negatively in school may not always be apparent later on. And since ADHD, these symptoms come from an early age, diagnosis is typically done in elementary. Are there ones that fall through the gaps or not diagnosed? Especially there's some older males now because it was not so recognized or seen as a good thing in the 80s or 90s. There was kind of a stigma to it. So there's a lot that are being diagnosed maybe later on as adults, but it doesn't mean it started as adults. It's always been there. So let's talk about the three different types. So when you consider ADHD, there's inattentive, so addressing some of that attention piece, hyperactivity, impulsivity type, more of the very hands-on, very fidgety you think about. And then there's the combined presentation or combined type. And this just means you're seeing both inattention and hyperactivity. And when you consider ADHD, yes, this has been overdiagnosed in the past and also underdiagnosed. And what that means when it's overdiagnosed, it means that maybe not every provider, every counselor or psychologist would use an assessment. And it can be very subjective. So I always recommend, and in this week we're talking about assessments, depending on your state license, or if you're a mental health counselor, counselors do assessments for ADHD, myself included. This is one assessment I enjoy doing. I actually use the Connors 3. So when you consider assessment, it is looking at multiple areas. So even given the example of Connors 3, you have a parent piece, a self-report. So if the child's of a certain age, they would do part of a rating as well, and then a school piece. So just realize that with ADHD, this can be assessed, and then you can utilize those for a parent or a client or a student could use that to not only seek treatment but also medication management. And this is right now the traditional route for treatment for ADHD. And when you consider different approaches with ADHD, and there's a lot of great resources out there. One of them that's been used for years is CBT. But one that's very effective, and I just want to note the difference, is MBCBT, or mindfulness based cognitive behavior therapy. And it's considered wave three, and you may not learn too much about it in grad school, but it's combining the components of traditional CBT with more of the mindful based practices. So grounding techniques, being more aware of yourself and others. So this is where this comes into play and can be quite useful. So throughout this week, when you read up on different tools that can be used, assessments, but also diagnosis, just think everything I just mentioned in this video, how it could definitely be overdiagnosed or underdiagnosed, but what's best for that child? What's best to help them, especially since some of these factors could have a social component or also cause issues interacting with others. So I look forward to everyone's comments this week and discussions, and have a great week.